Welcome to Health Watch TV. In today's segment, we're going to examine a medical condition that virtually all adults have experienced at one time or another in their lives. That's back pain and neck pain. Now, according to government estimates, as many as 80% of the population will experience back and neck pain at some point. With 30 million Americans dealing with the condition at any given moment, it's one of the most common reasons for missing work and leading cause of disability worldwide. Now, as widespread as back pain is, treating this condition still has no guarantee. In fact, at least $50 billion is spent in America each year trying to relieve their back and neck pain with treatment options from prescription painkillers and opioids to surgery, often with very disappointing results. However, there's a new medical solution for treating back and neck pain that's creating enormous excitement within the medical community, and it's called non-surgical spinal decompression. And it's proving to have amazing effectiveness and positive results in relieving back and neck pain and its related symptoms without the use of narcotics, injections, or dangerous surgeries.
Most chronic back problems are caused by compression from the disc becoming thinner and thinner as we get older. All we have to do is put the patient on the table and decompress them. By slowly and easily bringing water, nutrients, and oxygen back into the disc so it heals itself stronger than it was before. These treatments are so gentle, patients usually fall asleep. They don't have to go through the shots, the surgery, and the physical therapy or painful invasive procedures or drugs. They fall asleep, they wake up, and they feel better. That's what it's all about. The absolute best thing is pick up the phone and call us today for a free consultation. If you have an MRI scan, we can look at it and tell if we can help you or not. We'll get you in right away. So if you're looking at any kind of serious procedure, you may be able to avoid that.
In our journey today, our adventure towards health and wellness, we're going to take you out throughout a few of the Disc Centers of America clinics throughout the United States. The beautiful thing about Disc Centers of America is we're located from New York to the state of Washington. We're in California. We probably have more Disc Centers of America. We're the premier disc center in America, and all of our doctors are specifically trained. They're trained at a boot camp, ongoing trained at universities. They're all certified, and only Disc Centers of America doctors specialize in TDC therapy. So what I'm going to do is we're going to take you for a little tour. You're going to see why the professional athletes and people from all over the United States choose Disc Centers of America. So come on with me and let's go.
The reason someone would want to go to a Disc Centers of America doctor is because these doctors are very committed. They're held to a higher standard. They have to have a certification from a national university. They have to pass a test. They have to pass rigorous training. The training is ongoing. When you go to a doctor, you want to go to the best. You want the latest and the greatest. And I can assure you, Disc Centers of America's doctors are the doctors that you want to see.
Patient care to myself and to my family of Disc Centers of America doctors means everything. We want the patient to get one thing and one thing only, results. We want you to feel better. We want the patient to get their life back, to go back to lifting your grandchildren, go back to playing golf, go back to doing the things you love. We care about our patients at Disc Centers of America, where the patient is our number one priority and number one concern. We continue to grow at Disc Centers of America for one reason: we care.
I was in pain daily, radiating down both my legs, numbness in one leg, horrible pain during the day, and now after 30-something treatments, I am completely pain-free. I highly recommend spinal decompression. I'm living proof that it works.
Patient care is number one with Disc Centers of America doctors. This is what we are trained for. This is what we focus on. Number one is get the proper diagnosis. Number two, have the proper treatment. And number three, that will give that patient the results. That's why the patient came to see the doctor in the first place. They put their trust in the doctor. That doctor has to be very well trained. He has to be at the very top and know exactly what he's doing. And that's what I love about Disc Centers of America. We give those doctors those skills. We teach them the research. We teach them in the master class how to convey that to the patient. If you have the proper diagnosis, you'll get the proper treatment. What so many patients that we see, most everybody that we see, probably 90% of the patients in a Disc Center of America doctor's office, they've been everywhere. They've tried everything. They're at their wits' end. They're tired of trying treatments that did not help them. They spend a lot of time and a lot of money. This is where a disc center doctor comes in. They are trained to see if you are a candidate or if you are not. And that is where the training comes in. That is why our training is ongoing. That's why we're dedicated and committed to research and getting a proper diagnosis. What I tell my patients is when you go to the doctor, and if they recommend some treatment, ask them specifically, how will this treatment help my disc? And if they can't answer that, you're not in the right place.
Are you suffering with neck or back pain? Do you have a bulging or herniated disc?
At Disc Centers of America, we treat these conditions with gentle, effective, non-surgical spinal decompression and get you back to your normal activities.
You can avoid narcotics, risky injections, and unnecessary surgeries.
Get back to a normal, pain-free life.
Call today and schedule your visit at one of our locations. Don't wait, call now.
The experience of actually having the decompression treatment is very relaxing, really. I mean, you just lay down on the table. It doesn't hurt. You can feel the pull, but it doesn't hurt at all. In fact, lots of people sleep through it. It's very relaxing.
Equipment is a very important feature of Disc Centers of America. Disc Centers of America provides the best of equipment, the highest levels of technology throughout the industry. Matter of fact, today what we're looking at are 2 traction tables. You know, some people can get away with simple traction if they have a subluxation. But there is a difference between a bulge and a herniation. So there is a difference between traction and there is a difference between decompression. Traction is a linear pull that is often used for people in a stretching format. Some patients will receive traction, but some people, if the disc has become more involved, will need spinal decompression. So the beautiful thing about Disc Centers of America is we have a customization and we'll utilize a table that will fit your personal needs.
What happens when you go to a doctor that's a Disc Centers of America doctor clinic? What's going to happen usually first is you'll come in and you'll fill out some basic paperwork. The doctor will come in and do a consultation with you. Most people have an MRI. If they don't have an MRI, we're going to need to get one. But most people have one. So what the doctor will do, he'll sit down with you and go over your MRI. He can even show it to you, answer your questions, so you feel really good about going to the next step. Then the doctor will typically put you in an exam room. He'll do a few tests on you just to kind of shore up what he thinks is going on. Then what most people do is they get on the table. You stand up, you get lowered down, they strap you in. Now that sounds like a lot, but it's very gentle strapping. It's very comfortable, and you keep your clothes on, and you're going to be on the table for about 30 minutes. And the table will gently pull and release, pull and release. And what it's doing is it's kind of like milking a cow. I tell people every time it pulls and releases, it pulls a little drops of moisture back into your disc that's dehydrated, that's degenerated, that's bulging, that's herniated. And it naturally pulls that disc back where it belongs. So you'll be on the table for about 30 minutes. No fear of it hurting, no fear of it making you worse. Once you get up off the table, we're going to put you in an area and put an ice pack on your back for about 15 to 20 minutes. And then a lot of doctors like to use what we call a cold laser. The laser is like a magnet to blood. What it's going to do is it accentuates the healing process, it takes down inflammation in the body, and it gives you that relief that you're looking for. And once you've done that, the doctor or the staff will give you a folder, and it's got very important information in there that you should read. They want you to know and understand what your condition is, because then you can make a better decision on how to properly treat it. You don't go back down that road of pills, medications, shots, injections, failed back surgery. Those are all treating the symptoms. They're not treating the disc. And that's what Disc Centers of America doctors do. That's why we stand out, and that's why we are committed to excellence in the disc treatment of injuries. That's what we're all about.
So I did the decompression for my neck and the pain's gone. You know, I play racquetball, I lift weights, I'm very active, and it was great. My neck was great, and I said, how about let's do my back? So my back, whenever I did anything around the house, or I bent over, or I was, changing a salt cell or something, I had really bad pain in my back, and now it's not there. So I'm almost done with my back. My neck is done, and I feel fantastic. I go to the gym 3 times a week for 2 hours, every time I go, and it's kind of changed my life too, because I feel great, and I don't have the pain.
We change lives one back, one disc at a time, where we offer patients a non-surgical solution to back pain, to neck pain, pain down the arms, pain down the legs. Spinal surgery is now the last resort. The alternative should be non-surgical spinal decompression. Why? It's the safest, most effective treatment, most cost-effective treatment when it comes. The patient is the #1 priority. The patient must get their life back, doing the things they love. Why be invincible when you can be invincible?
I have to thank Disc Centers of America again for giving me my life back. I can move, I can walk, I can ride a bike, I can do all the things that I hadn't been able to do before.
Hi, I'm Dr. Sarah Knifechief, an orthopedic surgeon for 10 years. As an advisory board member for Disc Centers of America, I'm excited about the changes that technology is bringing to the back and spine industry. There are now non-invasive solutions for disc problems, shoulder problems, knee problems, and yes, even neuropathy. Let Disc Centers of America help you avoid these unnecessary procedures and surgeries. I would tell you to find the nearest Disc Center of America clinic and find out the non-surgical solution for your pain. Modern technology now allows us to treat pain without drugs. We utilize the most updated technology to get you pain-free and get your life back. I'm Dr. Sarah Knifechief, orthopedic surgeon, saying I think it's time America stays away from the knife and takes a non-invasive approach, first and foremost. Pick up the phone and call for a consultation. Let us help you get your life back.
At Disc Centers of America, we work clearly and definedly with the patient, and not all tables have a horizontal vertical lift, but that's an association to what your needs are. At Disc Centers of America, the treatment is so gentle that some patients actually fall asleep. But while they're doing that, we're monitoring the patient. We utilize the best of technology so we can be specific to the individual vertebrae, the individual disc, based upon the patient's individual x-rays, their MRI studies, and their neurodiagnostics. So we can gear, based upon the studies from Dr. Shealy, the McClure study, the Stanford study, Johns Hopkins studies, doctors from all over that have done studies, some of the leading medical institutions in the United States. So we're able to utilize this algorithm to find out how the patient is doing, where the patient is being pulled. This is a very gentle experience specific to your back and disc needs.
What doctors don't realize is that disc has the propensity to heal itself if you get the water back into it. It doesn't have a direct blood supply, so that disc has got to have the water. That's all the machine does, is it pulls water back into that dehydrated, degenerative, bulging, herniated disc. It pulls the water back in, so now the disc has the nutrients, the oxygen, everything that it needs. So it sews itself up and it repairs itself and it stops bulging. And the results are long term. It's such a beautiful thing. It's so simple. That's what I love, the simplicity of how this machine works, and how it works so well, and how it works long term.
If you suffer from back pain, you already know the effect it can have on every aspect of your life. Working, walking, or even doing everyday things around the house can be a constant, painful struggle. With advances in medical technology, we now have great news. Disc Centers of America provides a doctor's treatment option that could eliminate your back pain. With almost a 90% scientific success rate, non-surgical spinal decompression continues to help the tens of thousands of patients who have received this specialized care. Spinal decompression works by gently stretching and relieving pressure on the spine so that the spinal disc pressure that's causing your back pain is relieved. Slipped, bulging, or herniated discs retract, relieving the pressure off the nerves and other structures within your spine. The result is immediate pain relief and the acceleration of the natural healing process. So if you're suffering from back pain, neck pain, sciatica, or bulging or herniated discs, now you can stop hurting and start healing with non-surgical spinal decompression.
My back issues have just about totally disappeared. I've never had such great luck with my back, feeling as good as it is. It's really helped me in doing things that I wasn't able to do before.
Get right in, they get you on the table, they know what they're doing, they check on you. The doctor will come through and he'll talk to you while you're laying on the table. Just great. I mean, everybody did a perfect job. Wonderful staff and good place to go.
We are trained from day one that the patient is the most important thing. They should never be worried about coming to us about anything at all.
Disc Centers of America has trained me to be a caring person towards our patients. We want them to come in and feel comfortable.
Being able to relax and know that you're in good hands is, I think, one of the most important things. And if you are going to a place where you don't feel like you're in good hands and you don't feel like you have the care, the utmost care, then you're not going to come back and you're not going to listen to recommendations. So if we give them everything that we have and we treat them like family, then they're going to listen to what we have to say and they're going to know that we are out for their best interest.
He laid it all out for me. He told me what was going to happen. He put me on the table. My first decompression, it didn't hurt. It felt great when I got done. I went back for more treatments. I went through the whole entire regimen. I can't tell you the difference it's made in my life.
As a former NFL player, I've experienced multiple injuries, and I know that there is a world of drug and non-invasive healthcare that spinal decompression can bring to the table. As a teammate of many athletes who are experiencing pain and possibly feeling diminished capacity to compete at a high level, spinal decompression was by far the best way to non-invasively, drug-free treat back and neck pain by far. Over my 10-year career, I used spinal decompression to fix numerous problems and to keep me on the field when a lot of things would have probably put me either out on the sideline or possibly ended my career. So thank you, Disc Centers of America. Your technology has helped me save my life, my career, and keep me off of pain medication and injections that possibly could have had me addicted to drugs. As a former NFL player, I remember what it was to be a young man playing sports and not having a great foundation in knowing how to fix my body, how to keep my body physically able to perform at the highest level. And when you're a young athlete, you need to start doing the little things that start creating the foundation for health, whether it's chiropractic care, spinal decompression, flexibility training. These are the things that prepare the body to be dynamic and to be able to have motion. A lot of parents are scared to let their kids play football and be involved in contact sports, but it's not the sports that are the issue. The issue is we got to prepare our bodies better. We got to learn what makes us strong, what actually makes our bodies function better. And spinal decompression, chiropractic care are just two great ways to actually get your body in the best possible condition to be able to compete at a high level, to be able to function without injury or disability, to be able to give your body what it needs to actually maintain itself. No difference than when you do maintenance on your car. You go out there, you align it, you make sure the oil is there, you put the right fuel in it, and it performs for you. Same thing with your body. As a young athlete, I had to learn this too late in life before I went through injuries and pain, but now I'm able to educate young athletes and say, hey, this is something you can do to prevent. Prehabilitation is much better than rehabilitation. Go out there, learn about spinal decompression, learn about chiropractic care, start fixing your body and preparing it, and then all of a sudden you won't have to go through the rehabilitation and the pain and the surgeries that I had to suffer through as an athlete who didn't know better. One of the great things my uncle taught me was the earlier detected, the easier corrected. And spinal decompression and chiropractic care are two of the foundations of those principles.
I started coming in here because of the fact that I was in severe pain from my back. I've had issues with my back ever since I was 20 years old. I was lifting very heavy weights when I was a very young age and had issues that started to deteriorate, had back surgery. Came in here because it had gotten to the point where I couldn't walk anymore. I want to thank Disc Centers of America for giving me the opportunity to get my quality of life back, to be able, to provide for my family, to be able to, to go on with a normal life, whereas I gotten to the point where I didn't know which way to turn. Now, every door was closed through medicine. Medicine had closed every door on me. So the way out of it was not going through a physician, through medicine. And I would have never thought that would have been the answer, but it is the answer.
This is what we are trained for. This is what we focus on. Number one is get the proper diagnosis. Number two, have the proper treatment. And number three, that will give that patient the results. That's why the patient came to see the doctor in the first place. They put their trust in the doctor. That doctor has to be very well trained. He has to be at the very top and know exactly what he's doing. And that's what I love about Disc Centers of America. We give those doctors those skills. We teach them the research. We teach them in the master class how to convey that to the patient.
Since 2015, I was in such pain that I couldn't even walk. I would go to sleep and I would literally pull my hair from the pain. My back is really bad and my neck. Right now they're working on my back and it's been amazing. Since the day we came in here, I felt like I was in a place where they really care for people.
Spinal decompression was able to help me not only improve my abilities, it helped me improve my range of motion, it took pain away out of my body, and it kept me on the field for decades instead of just a couple of seasons. Many players don't get to experience a full career. They get injured and after 2 or 3 years, they're usually gone. But for me, spinal decompression was able to help me keep going and going and going after years and years and years of punishment.
I couldn't move, I couldn't do anything, and I came here and now I'm so active. It's just, I feel like I'm just almost back to normal, what I was before the accidents.
One of the key factors here is making sure that every patient understands that financial feasibility is never an obstacle to getting treatment. In other words, having the options that as Disc Centers of America doctors, we're able to afford our patients that make it simple, user-friendly, and really, really easy to accomplish what they want, which is number one, getting the treatment that they need, and number two, getting the treatment that they deserve. It's a win-win situation across the board. Our patients love it.
Well, I want to thank the Disc Centers of America, number one, for having it out where just about anybody can afford to have it done to their backs or to their spines.
The most common cause of back pain is pressure on the little cushions in the spine called discs. Our state-of-the-art tables easily and gently decompress these discs. This releases the pressure and allows them to ease back into position so they heal naturally.
I had pain in the lower back, and after I retired, I started working out, doing sit-ups, and the pain started shooting down my leg, my hip and my leg, and it just got unbearable. Within the second treatment, the pain in my leg went away. My hip went away, and I can't explain how good that felt. I want to thank Disc Centers of America because my quality of life has been just unbelievably better.
So it's very interesting. The reality is that we measure improvement both what we call subjectively and what we call objectively. Subjective, obviously, how the patient feels. Objectively, by what the tests, what the evaluations, what the examinations reveal. So what we often find is an improvement not just in the symptomatic relief, in other words, how the patient is feeling, but more in terms of what we call quality of life, the way they lift, the way they bend, the way they sit, the way they function, what we call the activities of daily living, and all of that, as a general rule, improves upon completion of treatment.
My quality of life was very limited as far as picking up my grandchildren, doing housework, golfing, gardening, mowing. I had to take at least 4 leave a day, and after I came here, I haven't been taking a leave. My quality of life is back. I regained my youth, I regained my activities, and I'm sleeping so much better. Before I could only sleep a few hours at a time, and now I'm able to sleep all night long.
When you see a patient that comes in and they are hurting and they are angry and mad at the world because of that, it hits something deep down. We've all been there. We all know how terrible it can be to be in pain. And to be able to bring those patients in, treat them, show them love and care and support, and to be able to see them walk out of here, but sometimes not walk out of here, but dance out of here and enjoy themselves and then be able to go play a game of golf. For us to be able to bring a quality of life back to people, it warms your heart. It makes you want to come to work every day, to know that you are not only, making people's lives better, but it makes you feel good deep down.
I've been able to do anything. We went to Florida last year, and I went out fishing in the boats, and we built fences, and we did about everything we wanted to do.
I sleep better. I wake up, I want to get out of bed. I don't lay there and look at the clock and say, oh gosh, it's only 7 o'clock. I'll just, go back to sleep till 9, in which I usually would. Didn't matter what time I went to bed. So I'm definitely resting better, which has also helped with my quality of life.
We are changing lives one back, one disc, one patient at a time. We take the vincible and turn them invincible. We don't enable the disabled. Our goal is let's get your life back. Let's get your life back now. Let's get back in the game. Let's go back to enjoying what you enjoy.
It's about getting the proper treatment, giving our patients the proper diagnosis, giving them a long-lasting solution to their problem instead of a temporary one with pills, shots, and failed back surgeries. These treatments are so gentle. You don't have to go through the shots, the surgery, all the physical therapy, or painful, dangerous, invasive procedures and drugs. Our patients love it. They lie down, they relax, and they get up. Most simply feel better. I've seen patients for years with back pain, and timing is key to most back problems. You simply can't wait any longer. Start feeling better now. Don't wait.
I was dealing with a lot of pain in my back. I have 5 hernial discs. My quality of life then, it was poor. Right now, my quality life is great. I can do the things that I couldn't do before. I feel good, I can walk. It made my life different.
You don't have to have surgery. Come here first, check it out, do the back decompression. It's gonna change your life.
It's very interesting. Being a Disc Centers of America doctor is really a commitment to excellence. It's a commitment to excellence with respect to the highest standard of care that is part and parcel of what a Disc Centers of America doctor establishes, not just for his clinic, not just for himself, but specifically for his patient.
When I came here, we started, my pain level was 10, of course. As weeks went by, my pain level dropped. As of today, my pain level is 0.
It's changed almost every aspect of my life because I just feel so much better.
We at Disc Centers of America do not take you, the patient, lightly. Matter of fact, you are our everything. We're changing the world one disc, one patient at a time. Disc Centers of America doctors are some of the most trained doctors in the United States on spinal decompression. Our clinics throughout the United States are focused on research from Harvard University, Johns Hopkins University, from the Mayo Clinic, even Stanford University. The best research, the best doctors trying to give you, the patient, the best results. So again, thank you. I want you to take this opportunity to sit back, relax, and know that you're in good hands with Disc Centers of America.